to speak about my personal experience of disability and co-occurring mental health issues. I'm autistic and have also struggled since my teenage years with my mental health. I will start by telling you why I started advocating in the autism and mental health space. I am a recent graduate of the Autism CRC's Sylvia Rogers Academy. The Sylvia Rogers Academy is an initiative of the Autism Cooperative Research Centre and delivers nationwide programs aimed at empowering autistic adults to contribute to policy and practices impacting upon their lives. I was a participant in the Future Leaders program last year. The program is Australia's first holistic leadership capacity building program for autistic adults. It empowers people on the spectrum with leadership potential to build and develop their skills. As part of the program, participants had to work on a personal leadership goal. My goal is to educate and inform mental health professionals on the specific needs of autistic adults. Did you know that the life expectancy of autistic adults is 58, and one of the top contributing factors to this shocking figure is suicide? Many autistic adults struggle in their day-to-day lives with mental health challenges. The figures show that 70% of autistic individuals have a mental health disorder, and 40% have two mental health disorders such as depression and anxiety. Also, it has been found that autistic adults are 9 times more likely to die by suicide than the general population. I want to tell you why this goal is so important to me by sharing a little bit of my personal story. I got diagnosed autistic in February last year, and let me tell you, the journey to hearing those words wasn't easy. I had been trapped, and I say trapped because that's what it had felt like in the public mental health system for several years now. I experienced a lot of invalidation by psychiatrists and staff who were treating me over the past years. One example I will share of many is when I was in a really negative headspace and said to my psychiatrist, I have been reading about women who are autistic, and it's like reading my life story. At this point, I was dismissed and told, you can forget the autism thing because you ain't autistic. Well, this is when I started the journey out of a need, not want, to self-advocate for myself. I went off and found a specialist in the area of autism. I then went through the process of having an autism assessment with a clinical psychologist, which at the end of, they told me, yes, Lydia, you are on the spectrum. I felt relieved yet so confused at the same time. I took this report back to my psychiatrist, who finally agreed, after fighting to be understood for so long, to send me to a different psychiatrist for a second opinion. After a long wait, the appointment with the second psychiatrist came along. I'd been in a state of limbo for a period of 5 to 6 months, trying to figure out where my place was in this world. Even though my mental health team had a diagnostic report from the clinical psychologist, this didn't hold any weight in their world. Every appointment I attended, my psychiatrist would repeatedly say, well, have you thought about what happens if you're not diagnosed autistic? And I said, yes, because that's not going to happen. The invalidation, disbelief, and being misunderstood by the very people who I have gone to for help in the most vulnerable period of my life have absolutely no idea who I am. They want to put me in their diagnostic box and only view me through that box. It was painful, so painful. Well, to hear the words from the second expert in the field was just the thing I needed to hear at that point. The second psychiatrist actually said to me that day, Lydia, you are autistic, and you will remember this day for the day that changed your life. And he wasn't wrong. I thought it was important to tell that part of my story because although unique to my personal being, it is just one example of hundreds, if not thousands, I have read or heard from my fellow autistics and the way they are perceived by not only mental health professionals but from people in all walks of life. The stigma and misinformation that has been spread about autistic people is the very thing that I would like to prove wrong, and that is why the goal of educating and sharing information about our unique but collective experience is something that I want to advocate for. I have found through my own experience that there is a so-called gap in the market for autistic individuals. As I have said, many of us have what is classed as complex needs, being that as well as living as an autistic person, many also struggle with their mental health, which can significantly impact on the person's day-to-day functioning in society. Many mental health services just don't have the depth of knowledge that is required to really support an autistic individual with their mental health. As such, many have been sent away from services, including CAMS, with quote, "We don't deal with autism." On the other hand, autistic or disability service providers have said to me personally, "We don't deal with mental health issues." But the thing is, I'm one person, you can't split me down the middle. My autism, although not a mental illness, impacts my mental health and vice versa. It is a co-occurring diagnosis. This is why many autistic individuals end up in the emergency department in crisis, either suicidal or after an attempt, as it is the only place there is left to turn to. This is the worst environment for an autistic individual to be due to many factors. First of all, the sensory overload or overwhelm that it may cause. The lights, noise, smells, being touched by unfamiliar people. Another is our communication differences. Many of us may not communicate in a typical way, which can lead to misunderstandings. Let alone in a crisis, some may become shut down or nonverbal with no way to communicate to the person in charge of their care. Another factor to consider is when an autistic person is in a crisis situation or presenting with suicidal ideation, the behavior they may display may be different. I have been told by my clinical psychologist that the individual may not present like others or in an expected way, in that they don't show distress or the emotion they are feeling inside. So many autistic people aren't believed when they say they want to end their lives. They are then discharged without help and therefore must feel like there is no hope at all. My psychologist now knows me well enough to know when I am in need of extra support. She also knows that I am very honest, which is a trait other autistics may show. You may be beginning to get a better understanding of the challenges autistic people face in accessing help, but I will explain further. Many adults are now being diagnosed as autistic later in life. Some people come to realize they are autistic after their children are diagnosed as on the spectrum. Or, for people like me who have struggled with their mental health, been in and out of hospital for many years, never really having a diagnosis that explains the whole picture, or being treated for a mental health condition they don't have. There is also the case of autism presenting differently in females than in males, or the learnt unconscious ability to mask autistic traits. As such, they tend to get diagnosed later than their male counterparts. The current ratio of male to female autism diagnosis is 4:1. I believe in the years to come, this ratio will reduce when there is wider knowledge of autism in females. Many would say, why bother with obtaining a diagnosis? But the thing is that many, once they get the diagnosis or realization that they are autistic, it's like a light bulb moment. It explains a whole lot of life experiences that could never be fully explained before and allows us to view our life through an entirely different lens. The diagnosis then allows us to get the appropriate help and support that we need to thrive in society. However, many individuals have difficulty accessing a diagnosis due to the cost of the assessment process. It is not currently funded for adults under Medicare and can cost you thousands of dollars out of pocket, which many adults cannot afford due to either having just had a child diagnosed or, like many autistics, are financially strained due to being under or unemployed. I'd like to suggest some reasons as to why I think so many autistic people struggle with their mental health. A main factor impacting my own mental health is being wired different to the majority, having a brain that isn't set up for the current world. I get socially exhausted and sensory overload. Every day I need a lot of rest, which just comes from living and interacting with the world around me. There is research emerging about autistic burnout, which prevents very similar to depression. The symptoms may be significant mental and physical exhaustion, interpersonal withdrawal, reduction in day-to-day functioning, and confusion or difficulty in executive functioning. There is usually an increased intensity of autistic traits and a reduced ability to mask. The reason this research and more understanding is important is because the way the two are treated or the recovery process is different. Depression is treated with not only medication but re-establishment of routine and social interaction, whereas what the individual needs when in autistic burnout is total withdrawal from social or interpersonal contact and externally imposed demands, time spent re-regulating such as stimming, which is self-stimulatory behavior, e.g. rocking, spinning, bouncing, pacing, repeating words or phrases. Without this time for people in autistic burnout to recover or a pressure to return to normal functioning too early, later burnout may have a significant negative impact on the person's both physical and mental health. A few other things I will briefly mention are that many autistic individuals also have a history of trauma and may have a co-occurring PTSD diagnosis. Because of our unique way of seeing and perceiving the world, many of us are taken advantage of due to our naivety and trust in others. Also, there is research emerging that there is an overlap between anorexia nervosa and autism traits. It is said that due to the restrictive and repetitive patterns of behavior, resistance to change, obsessive thoughts, and excellent attention to detail that are present in both conditions, it can be easy for one to mask the other. Without the autism diagnosis and the understanding that it brings, many are left stuck in the grips of the eating disorder. In conclusion, I think there is a greater need for education and training for not only the individual, but the services and professionals helping people living with a disability to maintain their emotional well-being. We must also be aware that the current strategies used to maintain personal well-being for the general population may not always be suitable for a person living with a disability, so alternative solutions are needed. I'd like to finish by saying the suicide statistics are a very real threat to an autistic individual's survival, but I know that our unique way of thinking can be used as a strength to help make change to improve the figures. With the right support, every autistic individual has the power to make a great contribution to our society. All we need is to be understood, accepted, and embraced by our fellow humans. Thank you.